The medication that the doctor prescribes is not to treat Alzheimer's disease because you cannot treat the disease. The medication is to treat the symptoms of the disease. The memory loss, forgetfulness, irritability, confusion, accusations. What happens is it does nothing for the progression of the disease, but what it can do is slow down the progression of dementia. It's basically affording you a better quality of life. We typically see doctors prescribe Aricept in the early stages, but you got to catch the early stages. And then after that, he or she may pair it with Namenda. NSAIDs used to be stated that you could use that for to reduce inflammation in the brain and to also improve memory. But what we know about NSAIDs now, it increases seniors' risks of death and stroke. And that's in your handout there as well. Now, here's the thing. You got to talk to the doctor about balancing it out now, because I have a client who has neuropathy, so she has to take pain medication. You know, that the whole opioid crisis thing. She has to take pain medication, but the doctor is going to balance it out because she's an older person and the family is well aware of the limitations, the benefits, and the risks. So you have to talk to the doctor about balance it out. Not saying don't take it. Even on that sheet it says avoid it, that means you need to talk to your doctor about the risks and the side effects. Antidepressants, we've seen, success with antidepressants on a low effective dose for seniors. But antipsychotic medications and behavioral health medications, we've seen very adverse reactions to that because those medicines are to treat mental health illnesses. Dementia is not a mental health illness, it's a medical illness. But the behaviors look like a mental illness, and so when they treat it with Risperdal and Seroquel and Ativan and Haldol, it sends the senior into orbit. The behaviors that they're supposed to be treating, it excites them, it exacerbates them. So now they become more confused, more combative, and they weren't even combative before. But that's because the doctor is treating the symptoms.